0845 6060 973 is the number to call to have your say. Let's talk to Roland, who's in Archway. Hi, Roland.
Hello, hi.
Hello.
Hi, thank you very much for having me on.
Well, thanks for calling. What do you want to say?
So I wanted to directly address your point, the one you just mentioned, which is, does it make any difference as to whether health service is provided by a private or a public organisation? And I think it matters enormously. I think it matters for a very simple reason, which is that a private company exists to make money. That is its purpose in life. If a private company does not make money, it dies. So, if a private company takes over a health service, let's say a diabetes service, it has to try and find ways to make money. Otherwise, there's no point in taking over that service.
Yeah.
And the way private companies do this at the moment is they re-employ people. The government passed a law to make it possible for private companies to re-employ NHS staff on lower terms. So they re-employ people, they employ them, but they pay them less, they employ less of them, they run less clinics, and so the quality of the service is reduced.
Yeah.
You mentioned earlier on, you just mentioned a moment ago, you said, I don't care, provided I get the best quality. The point of the current legislation that's gone through is that it does not guarantee that we get the best quality, because one of the key factors in now making decisions as to who provides a service is money, not the quality of the care.
No, but that's the thing. That's a very different issue from whether we are ideologically opposed to something or whether we, on the practical basis, we say, do you know what, we're not sure that there's evidence that private provision of healthcare is any more efficient and provides the same level of service. But what about you look at the mid-staff scandal? Publicly owned hospital, publicly paid staff, public service, and basically people were dying left, right and centre. Yeah,
okay, so you asked the simple question, which does it matter? Okay, and I've addressed that point by saying, yes, it does matter, because a private company will seek to make profit, okay? I want people to realise this. It matters enormously. Now, mid-staff, if you actually look into what happened at mid-staff, what the Labour government did was introduce a very hefty element of competition.
Oh, it was a competition.
Within hospitals and between hospitals and within hospitals. And it introduced a heavy target-based culture. Again, moving away from the concept of quality of care. So what you had, if you read the reports time and time and time again, the staff who were doing these dreadful things, and they were dreadful, were under enormous pressure to hit targets. Why? Because every single hospital is under pressure to reach Foundation Trust status. And a key part of reaching Foundation Trust status is hitting particular targets.
So it was fundamentally driven by money. Roland, you've put some absolutely fantastic arguments. I've got to be honest with you. I agree with them.